Dance as a form of psychotherapy originates from ancient rituals and cultural practices, where dance was used to express emotions, cure illnesses, and achieve spiritual purification. However, its scientific application as a therapeutic method began in the middle of the 20th century. Here is how it happened. 1. Rituals and shamanic practices. In ancient cultures, Africa, Asia, Latin America, dance played a central role in healing. People believed that through movement it was possible to exorcise evil spirits, restore balance in the body and meaning. 2. Expressive dancing in art. In the late 19th and early 20th centuries, interest in expression through movement arose in Europe and the United States. Dancers such as Isadora Duncan and Martha Graham emphasized emotional and mental liberation through dance, scientific basis and development. 1. Marion Chase and the Basics of Dance Movement. Therapy 1940s. Marion Chase, a professional dancer and educator, began to notice how dance helps people express suppressed emotions and improve mental health. She worked with patients in psychiatric clinics, helping them to cope with anxiety, depression, and trauma through motions. The influence of psychoanalysis, Freud, and Jung's ideas about the connection of body and mind inspired therapists to find methods that combine the emotional and physical components. Dance movement therapy began to use the body as a tool for working with the unconscious. In the mid-20th century, dance therapy was used to treat patients with depression, schizophrenia, and psychosomatic disorders. After World War II, dance therapy helped veterans cope with post-traumatic stress. Dance was used to work with victims of violence, natural disasters, and wars. It helped people express emotions that are difficult to convey in words, teaching children with special needs. Today, dance movement therapy is used in working with people suffering from burnout, anxiety, depression, as well as in cancer rehabilitation and work with age-related changes. Dance in psychotherapy remains a unique tool that unites the body, mind, and emotions, helping people to restore harmony and contact with themselves. Therapeutic dances differ from such forms of dancing as Zumba or aerobics, primarily in their purpose, approach, and technique. Here are the main differences. This is the goal: therapeutic dancing. The main goal is to improve the mental, emotional, and physical state. This is a way to express suppressed emotions, work through injuries, or relieve stress. Therapy focuses on self-exploration.